The health emergency for the coronavirus has been difficult for many workers, but especially for those with disabilities. One organization that helps them find jobs and advance towards self-sufficiency is the nonprofit Work Inc. To tell us how that has changed over the past couple of months is the group's president and CEO, Jim Cassetta. Thank you very much for being with us, Jim.
Good morning. My name is Jim Cassetta, president, as Chris said, of Work Inc., located in Dorchester. But we support over 1,200 individuals with disabilities throughout the entire Commonwealth. We go as far west as Springfield, Fall River, New Bedford. Our headquarters is in Dorchester. We actually manage and support 22 group homes with 202 folks with disabilities living in those group homes. A lot has changed, a tremendous amount.
Before we get changed, tell me about the age group, because these are mostly, I think, age 18 and over. So you're helping people through a transition period in your life, right?
Oh, yeah. We serve primarily adults, 18 and above. And believe it or not, Chris, our age group goes from 18 all the way to 80. We've been around since 1965, I believe, over 50 years. And we were born during deinstitutionalization in the late 50s, early 60s, when all the folks were deinstitutionalized, agencies similar to Work Inc. were established. And one of the differences about our particular agency, we firmly believe in choice, and folks should be able to work if they have the innate ability to work. Everybody wants to.
There's a whole continuum here, I think. You've got people at work sites, you've got people in education programs, and you've got people in residential programs. Is that correct?
Well, absolutely correct. We have contracts with many public schools, Boston Public being our largest one. For those folks who are listening who are in Boston, we're in every federal site in Boston. We do total facility management at the John F. Kennedy Library. We provide custodial services at the Moakley Federal Courthouse, and these are all done with individuals with disabilities, and they're making a paycheck, and as a result of that, they don't have to depend upon public assistance. They pay taxes just like you and I.
Well, right now, Jim, a lot of these places are either shut down or in lower gear. So what does that mean for your organization?
Well, it means a lot. We've had the biggest challenge for us was the closing of our day-to-day operation at Beach Street in Dorchester. We had 300 folks with disabilities coming in to receive services every day, Monday through Friday at Beach Street. All the day services are now closed. So we're doing virtual, just like you and I are doing it right now. We're doing case management services over the phone. We're not doing any face-to-face services. So we're very concerned about the fragility of a lot of those individuals who are physically coming into Work Inc. every day. A lot of them lived in group homes, and that had a ripple effect, because during the day, group homes like Work Inc. has 22 of them, but there are hundreds throughout the state. During the day, group homes did not have to provide day staffing, because their individuals who were living in those homes went to day programs like Work Inc. Work Inc. has 22 group homes. As a result, we had to find staffing from 8 to 3 or 3:30 or 4 every day, and that really wasn't in our budget. And I must tell you, the Commonwealth, through Secretary Sudders and the governor, has been very supportive of our industry. We're the safety net. You know, we really respect the first responders, the nurses, the healthcare providers, the police, the fire, but there are 180,000 direct service professionals in the state of Massachusetts supporting folks with disabilities in all the programs.
Jim, within those group homes, I imagine it's not exactly like a nursing home, but you probably have to take some new precautions around the virus, don't you?
Oh, we're very concerned. As a matter of fact, we currently have 3 group homes in quarantine, because a lot of our staff not only work for Work Inc., they also work for other providers similar to Work Inc. And Chris, we have over 600 employees, and unfortunately 90 of our employees are sick. And 3 of our group homes are in quarantine. What that means is that a staff member in the home has tested positive. Unfortunately, a couple of our residents who live in the homes with disabilities have tested positive. So we had to go into quarantine, which means 2 staff members work in that group home 14 days straight while others are in quarantine, getting better, and they're there 24/7. And that has put a lot of pressure on our financial ability to keep those homes going. So we have been able to get money from the Commonwealth to increase our staff's pay temporarily until this terrible crisis subsides.
Well, whether we're talking about a residential setting or out in a work site someplace, there must also be these new needs for protective equipment, right?
Oh my goodness, you hit it right on the head. Like I said earlier, PPE was an acronym. I didn't know what it meant. Now it's in our vocabulary. As a matter of fact, we meet at Work Inc. once a week we've established a procurement committee. We feel very strongly that this pandemic is here for a while. So right now we're trying to stock our own warehouse with 6 months worth of PPE, gloves, face masks, gowns, surgical masks. And I think over the last couple of weeks, the supply chain has softened a bit and we're able to get the PPE. Getting it is not the problem now. Getting the funds to pay for it is the challenge we have. That's why I said earlier, we have our largest fundraiser in June, which we had to cancel. So we're hoping folks will take a look at social media and join us in helping us raise money for the critical PPE that we need.
There are some of us on the outside who have encounters with people who have disabilities, who are on a job, and the impression usually is that these are people who really want to work and be engaged in the community. They can't do that right now the way they could before. How does that feel for them?
It feels just like if you or I weren't able to work. It feels, I don't know how that would feel for me because I work, but it feels terrible. That's been their social outlet. That's been their way to blend, to get back into society, talk to people, get appreciated, and people really, the stigma of people with disabilities staying home and collecting a public assistance is stigmatizing. They don't want to do that. I talk to people with disabilities all the time. What they want to do, if you ask them, they want to work. And we've been able to give them a lot of opportunities to work. Unfortunately, some of our folks are unable to work because of this pandemic crisis at this point.
What about connecting with them by remote? Zoom sessions, is there enough of that to really help that much?
Well, there is, but there's a learning curve, just like I had to go through recently, because I'll be 70 in June, and I didn't know really how to Zoom, but I'm doing it pretty good now. So we're doing that. We've purchased a lot of tablets for our individuals. We're talking to a lot of the families. Our case management staff are checking in with our folks almost daily at this point, and we're delivering much needed medical supplies and food to over 500 families just in Boston. We have a family support program at Work Inc., where these families, now the individuals they were caring for who don't live in group homes live with their families, but they used to come to Work Inc. every day. Now we're doing the opposite. We're going to them every day with food, medical supplies, and medications.
Jim, you mentioned fundraising. A lot of organizations in the nonprofit world right now have to figure out another way to do that. So what does that mean for you?
Well, we're actually having the fundraiser in June. It's a virtual fundraiser. It's on our social media page. It's on our website, www.workinc.org, and we're trying to raise the same amount of money that we would have raised. But Chris, I also call it a friend raiser. We usually have 400 to 500 folks attending. A lot of our staff attend as our guests. We recognize staff. We recognize the individuals that we support, and it helps educate the public that individuals with disabilities can actually contribute to the needs of society as opposed to be dependent on us.
Well, even if things open up quite a bit later this year, there will be some almost permanent changes coming down the line. What do you see for Work Inc. programs?
Very challenging. We actually opened up last week a reopening committee at Work Inc. because, as I said earlier, 300 folks with disabilities coming into work every day, some by the T. We've travel trained hundreds of individuals over the years to use the T. That's going to be a challenge because I don't know how the T is going to, I don't know what new rules the T is going to enforce when that reopens. Many of our folks were transported by transportation companies in vans, and some vans hold as many as 15 people. I can't comprehend how you can do social distancing in a van with 15 people in the van. Coming into Work Inc. itself, we're talking about taking everybody's temperature every day. We're talking about face masks. And, you know, we support a lot of folks with disabilities who have some concerns behaviorally. And I can't foresee forcing them to wear a face mask. So that's a big learning curve we're going to have to deal with. It's going to be a whole new world. I don't know what the new normal is going to be like, but it's not going to reflect the old normal whatsoever.
That seems to be what a lot of us are learning. Finally, Jim, if people want to follow on social media and connect, what's the best way to do that?
www.workinc.org, or look at our Work Inc. Facebook page. We're populating it every day with stories and you know, just asking people to support us, and we're supporting the people in the safety net. People with disabilities are being supported by great providers like Work Inc., and there are hundreds of us across the state.